Is urodynamic testing one of the main methods for bladder diagnosis? Have you ever wondered how doctors figure out what's going on with your bladder? Urodynamic testing is one of the main and most comprehensive methods used to diagnose bladder function and related urinary tract issues. This testing evaluates how well the bladder, urethra, and sphincters store and releases urine. It provides detailed information about bladder behavior that simpler tests cannot offer. Urodynamic testing includes a series of specialized assessments. For instance, uroflowmetry measures the rate and volume of urine flow. This helps detect weak bladder muscles or any obstructions. Another important part is the postvoid residual measurement, which checks how much urine remains in the bladder after urination. This can indicate if the bladder is emptying completely. Cystometric tests are also crucial. They evaluate bladder pressure and capacity during the filling phase. This helps understand how the bladder behaves as it fills with urine. Additionally, leak point pressure measurement identifies the pressure at which urine leakage occurs. This is particularly useful for differentiating types of incontinence. Pressure flow studies assess bladder pressure during urination. This helps detect any outlet obstruction that may be present. Electromyography, or EMG, records muscle and nerve activity around the bladder and sphincters. This evaluates how well these components coordinate during bladder function. Finally, video urodynamic tests combine imaging techniques with pressure measurements. This allows doctors to visualize bladder shape and function during both filling and emptying. These tests are commonly used by urologists, urogynecologists, and gynecologists to diagnose various conditions. These include urinary incontinence, bladder outlet obstruction, and neurogenic bladder, among others. Urodynamic testing is especially important when symptoms are complex, when surgery is being considered, or when previous treatments have not worked. Because urodynamic testing provides precise and functional information about the bladder and urinary tract, it is considered the gold standard for diagnosing many bladder disorders. It plays a vital role in guiding treatment decisions, including those related to bladder health and bladder cancer management when assessing bladder function is necessary. In summary, urodynamic testing is a mainstay in bladder diagnosis. Its ability to objectively and comprehensively evaluate bladder storage and emptying functions makes it essential in clinical practice for bladder health and related conditions. If you have concerns about your bladder, consulting a healthcare professional is always a wise step.